When should you start CPR for a child? Imagine seeing a child suddenly collapse and not respond. What do you do next? Knowing when to start CPR can make a huge difference in saving a child's life. If a child is unresponsive and not breathing normally, or only gasping, you should begin CPR immediately. Do not wait to check the pulse if you are unsure or untrained. The key is to act fast to keep blood and oxygen flowing to the brain and vital organs. First, gently shake the child and shout to see if they respond. If they do not respond, then check their breathing. Look for chest movement, listen for breath sounds, and feel for air on your cheek. Do this for no more than 10 seconds. If the child is not breathing or only gasping, start CPR right away. If you are trained and able, check the child's pulse for no more than 10 seconds. Feel for a pulse on the side of the neck or the wrist. If you find no pulse, or if it is less than 60 beats per minute with signs of poor circulation like pale or bluish skin, start CPR immediately. Begin with chest compressions first. For a child, give 30 compressions at a rate of about 100 to 120 per minute. Use your hands to press down about 1/3 of the chest's depth, roughly 2 inches. After the compressions, open the airway gently and give 2 rescue breaths. Each breath should last about 1 second, making the child's chest rise visibly. If you are alone, continue this cycle of 30 compressions and 2 breaths. If there are 2 rescuers, switch to 15 compressions and 2 breaths to avoid fatigue. If you are alone and the collapse was sudden and witnessed, call emergency services and get an automated external defibrillator as soon as possible before starting CPR. If the collapse was not witnessed or was gradual, perform CPR for about 2 minutes, which is roughly 5 cycles, before calling for help or retrieving an AED. When an AED becomes available, turn it on and follow its prompts. It is safe and effective for children over 1 year old. Remember, most pediatric cardiac arrests are caused by breathing problems, so providing effective rescue breaths is very important along with chest compressions. Keep performing CPR until emergency medical help arrives, the child shows signs of life like movement or normal breathing, or you are too exhausted to continue. Acting quickly and confidently can save a child's life. Always seek guidance from healthcare professionals for personalized advice, and remember that early CPR combined with EMS activation and AED use are critical steps in pediatric emergencies.